Welcome to Brain Wellness, the podcast. I'm your host, Mandi NP. Each episode will bring you a new topic or interview related to brain health and wellness as part of my mission to help you on the path to a healthier, happier brain. So, let's get started. Hello, everyone, and welcome back to another episode of Brain Wellness, the podcast. We are into the 6th season of this podcast, and I decided I wanted to do something a little bit different this season. So in between all the interviews, I'm going to throw in the ABCs of concussion, because since my accident, I have been drawn to do more with concussion and TBI. I want to give out a little bit more information, kind of focus the show this season on the ABCs of concussion. Now, there are 26 letters of the alphabet, so maybe we'll get 26 episodes. We'll see what all we can come up with on those letters. But today we're going to start with A and work our way through. So the English alphabet is what we're going off of. So A is our first letter of the alphabet for our ABCs of concussion. So the topics that we're going to cover today all start with the letter A. Before I get into that really quickly, I do want to just say that I'm also really excited that my book is now on Audible, which is also another A. So welcome back. A TBI recovery story from provider to patient is now on Audible. Of course, you can also find it on Amazon, another A letter. So at Amazon, you can find the Kindle version of it. You can find the paperback version of it. And then on Audible, you can find the recording. So if you want to listen to it in your car, although if you listen, I will warn you that you're going to miss out on the pictures. Somebody at work the other day was teasing me. He said, I didn't know you had pictures in it. If you would have said that, of course, I would have bought it right away. But yes, there are some pictures in there. So all artwork drawn by me. So there we go. So the ABCs of concussion, starting today with letter A is where we will go. So the first one is activity intolerance. This is something that is experienced by so many people with concussion and TBI. When we used to talk about treatment for TBI, we would talk about, or concussion, we would talk about the encouragement of people to rest after the accident in order to let their brains heal. And that rest didn't really have a time period with it. It was just until you felt better. You needed to rest. You needed to go and sit in a dark room and rest and let your brain heal from this trauma. Now we're finding that there actually is a time limit. We don't want to let people rest too long because that can actually lengthen their recovery time. I wish I had known this before when I had mine, because that might have helped me a little bit if I could have forced myself to get up, but it was very difficult to do so. That said, that time frame that we don't want people to rest too long, within 24 to 48 hours, you should start gently getting back into some kind of activity. That does not mean that you jump right back into the full swing of activities that you were doing before. It means very gradual increase in your activities. Start with something you can tolerate. Start with walking. That's a great place to start. And gradually kind of work your way back up. Notice where your symptoms are, and that's going to be your new benchmark for a little bit, but you do need to get back into that exercise and that activity of some sort. So again, like I said, the longer you remain away from the activity, the more difficult it's going to be to return to it. So that slow increase in activities is going to be great. If you're working with a physical therapist, which I really hope you are at this point, if you've been diagnosed with a concussion or TBI, is you're working with a physical therapist and you talk to them about your activity intolerance. What they might do is something called a buffalo treadmill test. You're not going to hear that name for it if you're the patient, but that treadmill test helps to identify where those symptoms come on. So it times you, and you talk about you rate your symptoms, headache, dizziness, blurred vision, anything that it might be before you start. And then periodically throughout the treadmill test, as you're increasing speed and the incline on the treadmill, as you're increasing the speed in the incline, you stop periodically, not stop, but you're being reassessed. So your therapist will reassess your symptoms again and rate those. And where you become really symptomatic, that's kind of where your heart rate new benchmark is. So that's your new heart rate benchmark for working out. And at that point, they want you typically to go to about 80% of that new benchmark where those symptoms appear. And that's where you're going to want to kind of use that activity as your guideline. And periodically, as you're working with physical therapy, they should be reassessing this and bumping up that activity tolerance and bumping up that heart rate goal as you go and as you improve. But again, you need to gradually return to the activity. And I will say that multiple times before I'm done talking about this segment because it's really important. The thing to keep in mind is that when you find those times where you have those increased symptoms, having those increased symptoms does not mean that you're going to worsen the injury that you have to your brain. It just lets you know where your limits are. That's where your new set point is, your benchmark, if you call it. And I always use the term hitting my wall, because when those symptoms kick in, that's when my wall has been hit, because I didn't listen to that little benchmark that would come on before all of those symptoms got there. That was my wall. I hit it. So why does this happen? I'm a why person. I like the why of things. So I can explain it to my patients. So I can explain it to the general population when I'm trying to teach somebody of why something happens when we have these symptoms. But why this happens is because there's actually damage to the neurons occurring when a concussion or TBI has occurred. The concussion itself, the action of the concussion, that rapid movement causes shearing of the neurons. So the neurons are what sends information to our brain. It sends information from one cell to another. It allows our brain to tell muscles to move. It allows our brain to receive information from our surroundings so that we know what's coming in sensory-wise. Smell, taste, touch, all of those things come in through neurons. And that information is passed around the brain through neurons. But that rapid movement, the stopping, the force of the accident causes shearing of the neurons, which means those walls, the membranes around the neurons become weakened, and they become the term we use called more permeable, meaning things can pass through that membrane that typically shouldn't have been able to pass through the way they are now. Potassium, for example, rushes out of the cells because of this damage. It just goes out like there's nobody's business. Nobody's stopping it. That potassium rushes out of the cells. Calcium rushes into the cells. So they're in our body for what we call homeostasis. We have to have this good balance of the electrolytes in the cells and outside the cells, in the tissue, in the blood, in the cells. Everything has to be balanced. And when it's not balanced, things don't work appropriately and we get dysfunction, we get problems. So calcium rushes out of the cells. Potassium rushes out of the cells, calcium rushes into the cells. This leads to what we call metabolic dysfunction. So that our metabolism is off because all of these electrolytes, these ions, are in places that they're not supposed to be in larger concentrations. The mitochondria, I've used that term on this show before. I hear it all the time working at Hypercharge Clinic, because we always talk about how we treat things down to the mitochondria. The mitochondria are the powerhouses of our cells. They're like the batteries of our body. They produce the energy that literally charges our internal battery in our bodies. So when those mitochondria are surrounded by calcium, which they're not supposed to be, they cannot make energy. So no energy is formed when we have too much calcium inside those cells. There are active transport processes that go on. Those transport processes are what allows the different ions to move back and forth between the cells. So these active transport processes in the body all open wide up to try to get a rebalance of all of those ions. That takes a lot of energy in our body. So there's this increased energy demands by opening all of these channels in order to try to rebalance things, while the mitochondria are not being able to create new energy. Now the brain can't function efficiently. That leads to an exacerbation of your symptoms anytime you have cerebral exertion. I read this the other day in a course that I was taking, a little webinar, and I learned that I put learn in air quotes because I've learned this before, but it's information that was lost. It was disconnected during my accident. So I don't remember learning this before. So I learned it in this webinar that I took recently, and it totally explained why my symptoms get worse when I have to use my brain more. So cerebral exertion, I'm exerting the energy that is needed to function my brain appropriately, but I can't create that energy at the same time. So we have this exacerbation of those symptoms. So that's what leads to the activity intolerance, is this disbalance between the energy production and the energy use. or the need for the energy, that I should say. And then depending on the severity of the injury will depend on how long this progresses. And then unfortunately, we have this other thing called use it or lose it. So while our body is fighting this whole thing, we now can't do the same level of energy that we used to, or do the same level of activity that we used to. And now it's causing problems because it's going to take us longer to get back into it. Think about any time you've been in an exercise program, and if you've fallen off the wagon, as we call it, it takes you longer to get back into it, right? Because you've lost some of that muscle mass, you've lost some of that muscle memory in your body. So now you have all these new physical symptoms which limit your activity. And then when you want to try to get back into it, your body's like, no, we haven't done this in a long time. It's going to take me a while. So you get that activity intolerance, and then you get this secondary activity intolerance because you haven't been doing things for so long. So it's a vicious cycle that you get into. That's our first A. Second A is advocating. So advocating for yourself. This one is a really, really tough one, and also really near and dear to my heart because as I've had conversations in previous shows, not all calories are created equal, not all exercise is created equal, not all providers are created equal. So unless you see a concussion specialist, the provider that you see probably is not going to have all the answers for you. And I'll give you the caveat that even if you see a concussion specialist, I'm going to put that one in quotes, they probably don't have all the answers, because when I'm looking at all these different certification programs, and I'm looking to get certified in concussion because I'm so passionate about this now. When I'm looking at these different certification programs, they are very much focused on our traditional Western medicine, which traditional Western medicine did not heal me by itself. I'm still not fully healed, but it did not heal me to the point where I am right now by itself. I needed the complementary medicine. I needed the things that we typically think of as outside the box, which are now inside my box. My box is just, there's more in it. There are more tools in my toolbox. So that box just got bigger. I'm not limited anymore by these traditional Western medicine practices that we normally think about. I think about those things outside that tradition, because it's the things that outside that tradition that help me get to where I am now. So my word to you is that if you feel like you're not getting what you need to speak up. You need to ask questions. You need to ask for referrals, ask for second opinions. There are other places that have probably treated patients that maybe have the symptoms that you're having more than the person you're seeing right now, because the person that you're seeing right now is only held captive to the experiences that they've had. So if they haven't dealt with certain parts of the diagnosis, they might not be as well educated on different parts of it. So the other thing with that is that you might not know all the things that you need. So when you go to your appointments, I encourage you, if you're the patient, bring a trusted friend or a close family member to those appointments that can ask questions, that can take notes, that can bring up the things that you forget. Because as I was going through, and I still find that there are things that I don't recognize that I'm doing that cause problems in my day-to-day life. I don't notice that I'm doing them. Other people have brought it up to me, and then I can be aware, and then I can try to keep an eye out for it, but I still don't know that I'm doing certain things. And I'll bring those up as we talk through here on the different A's that come up. But that can be a big issue, and you really need to make sure that you have somebody with you that you trust, that can speak and advocate on your behalf until whatever point comes that you can do it on your own again successfully. Aggression. That's the next one. So aggression is our next A. Aggression can be verbal or it can be physical. It can be related to a mood disorder that's triggered by the brain injury. It can be related to personality changes depending on where the brain injury occurred. It will be worse with people who've had some sort of pre-injury psychosocial difficulty, if they have anxiety, depression, any other kind of mental health disorders prior to the accident, prior to the injury. They're going to be more likely to have issues with aggression after the accident or after that injury as well. If people have significant alcohol or drug use or abuse, that's going to lead to more aggressive issues as well, or specifically frontal lobe injuries. Our frontal lobe is where our judgment is. That's where our personality is. That's when we have personality changes, that's where that's going to happen. So any injury that causes changes to that frontal lobe increases the risk of aggression occurring as well. When I talk about aggression, it's not just like, oh, just a little bit of frustration. It's like over the top sometimes. And this is one of those things that I don't always notice. A lot of times I do, but I sometimes don't notice until after it's come out, after I've stirred the beast. And now I have to go back and apologize to everybody because I didn't realize what I did until it was done. So what is it triggered by? Because there's usually a trigger. It doesn't usually just come out of the blue. There's usually some sort of trigger. It can be overstimulation, meaning there's just too much going on and your brain can't handle all of those things that are going on. So overstimulation, pain, hunger. We joke about people being hangry and they get angry when they're hungry. We'll take that to the next level with somebody that's got a brain injury and now they have this aggression that comes out when they're hangry. It's even worse than just normal hanger. You can't just give them a Snickers bar like on the commercial and say, hey, you're back to your normal now, because that's not going to work all the time. Although feeding it sometimes does make it go away. So hunger, lack of independence, which is huge after a brain injury, because I still a year and a half in, note that I don't do a lot of things as well as I did before. And some things I'm still not fully independent on, like driving for long periods of time, because I can't do it still. Uh, I need help. There's a lot of things that I need help with, and I'm not able to be as independent as I used to be, which drives me bonkers. Uh, disability, just the disability itself, the inability to do things that you used to do, the inability to do things as well as you used to do them, that can trigger some of that verbal or physical aggression as well. And then difficulties in perception. Perception meaning you don't quite read things correctly from other people. I don't always read things correctly from other people. I don't always have people read things correctly from me. So that can lead to arguments. It can lead to confrontations. Confrontations, not so much with me, but it can with some people lead to confrontations, and that can bring out that aggression as well. So all of these things can be triggers for that aggression. What do we do about it? It's there. Some point, sometimes it'll go away on its own. It just needs time. As your brain heals, it will go away on its own. Sometimes you need to learn some coping skills. And that's what I've had to do with some of this is first and foremost, removing yourself from the situation. So if you're overstimulated, removing yourself from that situation of overstimulation so that you don't have that aggression come on. A lot of this is going to be on the person with the brain injury, unfortunately, reminding themselves to take that break, or having that trusted individual to say, hey, I think you need to take a break now so that you can get away from this, calm down, and then come back when you're not so overstimulated. Eating healthy. And when I say eating healthy, I think we've had this conversation just a few times on this show and on the radio show that I do with Dr. Cinecropi. We've talked about it a lot there as well, especially. Eating healthy does not mean the same thing to everybody, but eating healthy really means eating whole, real foods, getting a good variety of foods, making sure that you're getting plenty of protein. Your brain is going to need a lot of protein in order to heal from an injury. And then healthy fruits and vegetables, some carbs, because you still do need carbs for your brain to function. You don't want to go completely carb free, but you can even get carbs in your vegetables. So just making sure that you're getting those main food groups covered, just choosing those foods wisely, not eating a lot of junk food because that's going to cause more inflammation. It's going to be more difficult for your brain to heal. Not eating a lot of processed foods because that's going to do the same thing as the junk food. Anything that comes prepackaged, pre-processed has a lot of chemicals in it that can cause more inflammation to your brain. So eating healthy means eating real foods as much as possible. We'll talk about that coming up because there are other issues with eating that will come up after a concussion as well. Other things you can do because of this aggression: journaling. Journal what happened, what you saw. There were times that I would actually remember to grab my journal and write things down. And I would write things down and talk about how frustrated I got with something. And I looked at it and I'm like, well, that's stupid. Why did I get upset about that? Because it wasn't something that I typically would have gotten upset about. So journaling can help you identify when there are things that happen that aren't your norm. Meditation to try to calm some of that aggression down, And regular exercise, we don't talk about that one often enough, but it's the most underutilized therapy for anxiety, depression, any of those things possible. So regular exercise can definitely help to regulate your mood. Something that can lead to some aggression, the next A is amnesia. When we talk about amnesia, this is more than just a little bit of forgetfulness. This is a lot of forgetfulness. The two main types of amnesia are retrograde amnesia or anterograde amnesia. Retrograde is forgetting things or even just parts of things that happen prior to the injury. This usually improves over time. Those memories were created, they were stored, they're there. You just have to learn to reaccess them. So those memories typically are not gone for good. However, the anterograde amnesia, that's things that are happening after the accident because you have difficulty forming new memories. When I was working with my speech therapist at one point, we talked about how memories are created, and you have that memory, and you have things that are related to that memory that helps you store it. It has to be stored and processed and actually put into your long-term memory in order for you to keep it. If you have forgotten it somewhere in between the learning it and transferring it into your long-term memory, it won't stay. So you won't actually have that new memory. So it makes it difficult to learn new things. Boy, do I know that one really well. I'm having difficulty learning new things. I'm having difficulty relearning the things that I learned before. Because while I do still have those memories somewhere in my brain, the bridges all got broken. So I'm trying to get new access to the areas in my brain so that I can access the knowledge that's in there so that I can be a provider again at some point. And that's the struggle because I'm trying to learn things. I'm trying to relearn things, but it's difficult because forming those new memories is really tough in my brain right now because it's still trying to heal a year and a half into this dang injury. So when we look at these, there are different severity levels of concussion and TBI, and this is where it does become a little important with those different severity levels. Somebody with a mild concussion typically doesn't have lasting amnesia. They might have it for a short period of time, but it's not going to last very long. So there's a lot of the research says that a true concussion, most people are going to heal within that first month. Days to weeks to that first month is kind of that concussion cutoff. Anything beyond that really moves into the TBI category. So once you're beyond that time frame, everything's going to take longer, basically. I will tell you that from personal experience. Everything's going to take longer if you haven't fully healed at a month. But know that things can still be created. New connections can still be made beyond that first month. But that's where we kind of get hung up on this. So more severe concussions, more severe head injuries can result in permanent amnesia. And that's the part that it's tough to deal with because people don't want to admit that something's going to be permanent. Because it's there doesn't mean that you're going to necessarily constantly struggle the rest of your life, but you're going to have to learn new ways to deal with it. And that's where I'm at, is trying to figure out new ways to deal with it. Anybody that's at the same kind of level that I'm at right now, we're learning to cope with it. We're learning to use strategies to try to remember things. I have my Remarkable notebook. It is remarkable. It is just the name as it implies. My husband got it for me for Christmas last year, and it was the best gift I think I've ever been given because everything goes in that notebook. I have a file for everything, my doctor's appointments, any meetings that I have at work. My notes are all there, so I can review those notes. And that's how I learned how to do things for my new job, was writing those notes down and reading them over and over and over again until it actually clicked and stuck. And now, months in, there are times I'm still looking back at those notes because there are things that I still forget. But the grand majority of it, I'm starting to remember at least parts of things because I've written them down and read through my notes again. So it can be worked around, even if it does become a permanent problem. When people have repeated head injuries, that's where we get into the difficulty of things becoming definitely permanent. It can lead to memory impairment, long-term memory impairment, permanent memory impairment when things don't come back, and repeated head injuries, especially sports related. We can see neurodegenerative diseases coming on. So think about years ago, the boxers especially have this. Muhammad Ali developed Parkinson's disease, and they were able to connect it to the fact that he had multiple head injuries during his boxing career. So having those repeated injuries over and over again, football players, the same thing. Any athlete who's going to have those repeat concussions is at risk of having those neurodegenerative diseases occurring later on in life. So there are potentially long-term consequences of this depending on the severity of the concussion and head injury itself. That's where those terms come into play more often. On a day-to-day basis, trying to make any sense of the different levels of concussion versus mild TBI or moderate TBI, whatever terminology you want to use, are less important because we look at the symptoms that the person has. The next thing, next symptom that can start with an A is anxiety. And that's another one that we see that's caused by changes in the brain following a head injury. These can be chemical changes. They can be structural changes because of the damage that occurs. They can also be triggered if you have a genetic risk for them. So if you have a personal history of it or you have a family history of anxiety or depression, that's going to be triggered when you have a head injury. So now you're going to be more likely to have anxiety and or depression. When we look at anxiety in this setting, it can present in multiple ways. It can present as almost like a social anxiety. So being in a very stimulating environment, lots of people, lots of noises, being out in public, that can be very overstimulating and cause anxiety for people. On the flip side, it can also cause anxiety, almost like a separation anxiety, when you're away from the people that you trust, especially if you're very dependent on them in order to do things. Initially, I don't know how long it lasted, and I don't think it's still completely gone away. I do have issues if my husband is gone for longer periods of time than I think he's going to be, and I get very anxious when he's not home when I expect him to. Now, there's always a little bit of that when you're in your first year of marriage, whatever, any of that going on. You always get concerned about that other person, but this is a different level of anxiety that occurs when you're not with the person that you trust. It can also be very anxiety provoking when things change when you didn't expect them to. I joke a little bit now. I have a son with autism, and I feel very much akin to him right now in multiple ways because he doesn't like change. He does not deal with change very well. It causes his aggressive behaviors, and it causes anxiety in me now too. Unexpected change, things happening that you don't expect them to, or in a way that you expect them to. Things become very black and white. And when you kind of dabble in that gray area in between, it can be very anxiety provoking. So that is a thing. Anxiety related to head injuries can be short-lived. It can recover, it can go away fairly quickly, or it can be longer lasting. And again, you might need to learn some new coping skills to deal with it. How do we treat this anxiety? As with any kind of anxiety, dealing with mental health therapy will be helpful. And then the non-traditional things that I've found, photobiomodulation, red light therapy, or energy therapy can be really helpful for treating things like anxiety. It can be helpful for treating brain injury in general, but it can be really especially helpful for treating things like anxiety, whether it's TBI related or not. EWOT, exercise with oxygen therapy. There's a lot of research on the hyperbaric chambers. EWOT is a very similar thing. You get the same kind of results, except you're doing it in a much shorter period of time. So EWOT, you can get the same results as several hours in a hyperbaric chamber in 15 minutes on a bike with breathing 93% oxygen via a mask. That can help treat anxiety, TBI related or not. Also, neurofeedback, another non-traditional thing that I tapped into as well, can also be helpful for anxiety, again, TBI related or not. So people that are listening that don't have TBI, these are therapies that can be helpful for your anxiety as well. Of course, there's always prescription medications, and sometimes we combine medications with therapy, with some of these other things for a short period of time, get the results that we need, and then we can taper back off those medications again. And as I mentioned earlier, regular exercise, because that's one of the most underutilized treatments that we have for anxiety, and improved sleep. The more issues that we have with sleep, the more issues we're going to have with our mood, with our memory, with brain recovery in general. I will talk about that probably in another letter in the alphabet, even more than just this comment right here. Aside from anxiety, the next A that we can experience is apathy. So apathy, if you don't know what that term means, it just essentially means no appearance of emotions or somebody having a flat affect. It just means that when you tell somebody a joke, they're like, whatever. When they're sad, it's whatever. They might just not express emotions as deeply as they did before the injury, or they might not express emotions at all and just be that flat affect and having no appearance of emotions. But doesn't just because they can't show the emotions doesn't mean they don't feel them. They still feel the emotions. They're just not able to express them as they used to. Treatment for apathy, psychotherapy, again, that mental health therapy. Other things that have been proven effective are mindfulness, relaxation, and again, I'm going to add that photobiomodulation in there because that can also treat this as like a mood disorder, and that can be very helpful with that red light therapy as well. The next A that I want to talk about is another thing that I experienced was appetite changes. Appetite changes after concussion can have a wide variety of what it looks like. You can have a loss of appetite, so you're undereating, or you can have overeating, anything in between. So that overeating part of it comes from a lack of self-restraint. Again, depending on where the brain injury is, our frontal lobe is that judgment, perception, personality. If you have a frontal lobe injury, you can get that lack of self-restraint leading to overeating. The rest of the things I'm going to say kind of lead to the undereating part of it. Dysautonomia, the autonomic nervous system dysfunction, can have a lot of different effects, including the exercise intolerance. At the beginning, that very first thing I talked about, but the dysautonomia can slow down your digestion and make you feel full when you're not. So you just don't want to eat because you always feel full. Smell and taste can be affected by brain injuries. That decreases your appetite because when you can't smell food, when you can't taste it, you don't really feel like eating. There's a long known standing connection that we have between the gut and the brain. So sometimes they call the gut our second brain. It's very much connected. What we eat goes straight to our brain. If we eat a lot of toxins, it goes straight to our brain. It causes brain fog. If we eat a lot of food that's not good for us, it goes straight there. If we eat a lot of food that's good for us, it goes straight there too. So we have that good connection. But that connection can get very much disrupted, leading to difficulties even identifying that sensation of being hungry. So you lose the sensation of feeling hungry in addition to feeling full when you shouldn't feel full and yada, yada. Lots of things can go into that dysregulation of your appetite. Yay. So what do we do for that treatment? Typically, they'll try to recommend eating smaller, more frequent meals. But again, if you don't have much of an appetite, you're still going to have difficulty eating smaller, more frequent meals just as much as you would with a big meal. You just have more times that you're introducing it and more times that you're saying, hey, brain, are you hungry now? Hey, no, okay. But more options. One thing that you can do, especially if you're having memory issues and you forget to eat, because that's another one there, is just forgetting to eat, setting alarms if needed. So you set alarm for yourself every so often so that you have a time where you think about, can I get a snack in now? Can I get something in now? I talked to a nutritionist at one point who said getting liquid nutrition is better than nothing. So if you can't eat food, at least get a protein shake or something in so you get some kind of protein and you're getting some kind of nutrients in your body. The other thing that as I was going through the non-traditional treatments, I was recommended to take some amino acids if I wasn't getting food in, because then I was still getting some of those essential proteins that my body needed for brain healing. And I did feel a lot better once I started taking those amino acids, even though I wasn't getting much food in. I was still getting some of those nutrients that I needed. So many things involved in appetite changes after a TBI. The last A on the list is attention, and also considered with ADHD. So attention deficit hyperactivity disorder, or without the H, you can just have attention deficit disorder. Any of that can develop after a TBI. And you wonder, maybe can it? Yes, it can. The ranges are from like 5% all the way up to 50%. And that again depends on the level of severity. So concussion would probably be on that 5% up to a severe TBI being on that 50% part. So Anywhere in there is that range of the likelihood that you will exhibit ADHD symptoms after experiencing a TBI. Mayo Clinic has a lot of research on this as well. So there's a lot of stuff out there to support that this is a thing also. And some of the research that I found online doing PubMed searches is that this is actually found in all ages. So across every age span, anybody that can have a TBI has an increased risk of having ADHD following. So again, what do we do that with this? We need to limit distractions, focus on one activity at a time. I even commented on this in my book that I talked about at the beginning. I can't really multitask anymore. I have to focus on one task at a time. And sometimes even that is difficult, but there is no multitasking. Sometimes we joke with ourselves and we say, oh, I can multitask. I know now that I can't. So one thing at a time, that's where I try to keep my limitations so that I can focus and increase my focus, increase my productivity when I'm working on that one particular item. So that's my A list. And I'm sure that there are so many other things that I could have included on that list. But that's my A list for today. So again, the ABCs of concussion TBI, I will throw those in as we go out throughout this whole next season. So there won't be another season, maybe until after I get through the whole alphabet, but we'll see where that all goes. If you have any thoughts on what I should cover in the upcoming letters, please leave a comment, send me a message through any of the ways that you can find me on all the social medias. Go ahead and leave me a thought of something that you would like me to include in the alphabet as I come up. Otherwise, yeah, that's it for today. I hope you learned something new today, enjoyed the show, and I will see you next week. Thanks for tuning in to this episode of Brain Wellness, the podcast. If you enjoyed this episode, I encourage you to subscribe, like, and share this with others to help me continue on with my mission to help people live healthier, happier lives. Go to www.brainwellnesssolutions.com to see what I'm up to and get links to all the social medias there. See you next time.